Welcome to the Off Leash Podcast with Dr. P. I'm your co-host Molly, and we're so glad that you joined us for today's show. Remember, we're not here to say what you want us to say. We're here to be an advocate for your pet, as per usual. Dr. Pete's sitting right across from me.
With not much to say yet.
Dad. Come on, Dad. Give me some fatherly advice.
I'll give you sage advice. You know what sage
advice is like wise advice from old people.
That's exactly what it is.
You are old.
It's when old people tell you stuff, man. Old people.
Old people tell me stuff all the time.
And it's sage advice.
I don't know if it's sage advice. It's something. All right. Today, we have a very interesting topic. We're going to be talking about shit. Specifically, fecal microphobia. Wait, is it not microphobia? Microbiota?
Biosha.
There's not even a C in it.
I don't know.
I see it spelled Microbiota. Microbiota?
Microbiosha.
It's called a bunch of different things.
Yeah, I know. Anyway.
Fecal microbiota. I'm going to call it microbiota.
Well, it's kind of a new thing. So it's kind of an old thing that's
okay, first of all, let's start out. What does it do? What is the purpose of transferring a dog's shit into another dog?
Well, here's the story. So typically, and here's how this has worked for years, we would have a dog that came in with diarrhea. We would run fecal to see whether it had hookworms, roundworms, whipworms, and then mostly looking at stuff like that. And that probably was the first 20 years of my career that we did that. And then as time went on, we started to recognize there were some certain bacteria that caused problems when they were found in the GI tract, specifically Clostridium perfringens. Clostridium perfringens.
What is that?
It's a bacteria, Clostridium bacteria that makes an endotoxin that causes a dog to have diarrhea, and they actually even sometimes vomit.
Okay, I'm going to need you to explain this to me like I'm a fifth grader.
No, I just did.
No.
Yeah.
Like, break it down more. Because I know if I don't understand it, half the listeners
Well, it's Clostridium perfringens. It's a bacteria. It's producing.
Where do they get it?
They get it probably from walking outside and coming in with stuff. Licking their feet licking or drinking out of a mud puddle or drinking out of a bird bath. Yeah. Okay, what else can you get? Salmonella. Salmonella is something else. So you just call that songbird fever, from drinking out of a bird bath or birds drink. But, dogs that go out and eat sometimes other animals' feces, sometimes they'd eat dead birds, they eat all sorts of stuff. And typically, a lot of dogs wouldn't, or goose poop. That's right.
My dog goes down to the lake and eats that like it's candy.
Yeah, well.
Not Sage or Stetson, the Dachshund.
Oh, the Dachshund. The Dachshund. Yeah, well, we need to get you a prescription of smart pills.
No.
Anyway, so what happens is then these dogs get diarrhea.
Sorry.
They get diarrhea. And then usually in the past, we'd always treated them with, one or two antibiotics, sometimes amoxicillin, sometimes metronidazole or Flagyl, sometimes Tylenol. So those are probably the three big hitters for us on using that. Now, we used to go ahead and do a cytology, which means we'd stick a swizzle stick in the, like a Q-tip, sterile Q-tip, and rotate that around in the rectum and then pull that feces out and put it on a slide and stain it. So what we're looking for we're looking for Clostridium perfringens, if that shows up.
Clostridium perfringens.
Yeah, Clostridium perfringens.
Okay.
Another Clostridium would be the one there, Clostridium tetani, which causes tetanus.
How many Clostridiums are there?
It's probably 25, I guess. I don't know. I couldn't.
Can you see them? Like, okay.
Yeah, you can see them.
You do a little swizzle stick, whatever, in the butt. Take it out, put it on the stain. Can you like...
It looks like a safety pin.
Can you like accurately look through and you know exactly like all 20 types?
Our technicians? No, you don't know the 20 types. We just know the Clostridium perfringens looks like a safety pin.
Oh, okay. And there's 20 of them around. No. This is just a specific one.
This is a specific one, Clostridium perfringens. And the more Clostridium you see in the stool, the theory would be typically that the more Clostridium you saw, the more likely they would be to have diarrhea, and the more likely the diarrhea would be caused by the Clostridium. And they produce an endotoxin, which means then they get sick from that. They can get sick from Clostridium perfringens.
What sickness are we talking?
Well, they just don't feel good.
Vomiting, not eating.
Yeah, basically, it would probably mimic food poisoning to a certain extent.
Okay.
Vomiting, diarrhea. It's where we used to laugh a little bit about that. Where the rectum and the tonsils were just a couple inches apart.
Yeah.
Because you were so sick. And so I think that's one of those things that we recognized. I think then the more popular term recently was dysbiosis, dysbiosis, dysbiosis. And that is an imbalance. So you have two kinds of bacteria typically in a stool, rods and cocci. So in other words, the rods are obviously rod-shaped and the cocci are round. And then you look at those, and there should be equal numbers of each in there. And there should be a certain number you would expect to see.
Isn't one of them healthy? Yeah. Both of them are
No,
healthy?
they're both healthy. Yeah, I mean, both belong there. But you can get an imbalance. And when you had, and I used to tell people this was a little like Arkansas, there's too many Republicans and not enough Democrats, or a little bit like California, too many Democrats and not enough Republicans. Now, we both understand that probably those states to a certain extent are somewhat dysfunctional, at least from a political standpoint. So what you're trying to do, I would tell my clients that we're trying to turn your ball into Pennsylvania or Wisconsin, to where there's just about equal numbers of both. And then really what would happen here was you would get the whole idea of having diarrhea is to get rid of the thing that's offending your dog and get as much of that out as you can. And sometimes what would happen is the diarrhea would kind of go away, then it'd come back, and it'd go away, and it'd come back. Those dogs we always knew probably needed some antibiotics to sort of put everything in line. Now, recently there's been a big push by pretty much the dog food companies and university people not to use antibiotics to try to treat diarrhea.
Why?
That's a good question, because they think that it causes an imbalance and causes some damage that may take the dog a long time to get over once you've done that. In other words, now you've gone in and kind of cleared everything out. You know what I'm saying?
I'm kind of reading about it as we talk about it. One of the things that says here, it obviously says antibiotics could be a treatment before this. The other one is probiotics.
Yeah.
How do you feel about that?
I'm not a big fan of probiotics. I think if your dog has diarrhea, you need to... Hold on. Now stop. When you have a dog that has diarrhea, do you want to screw around for 3 or 4 days clearing up this diarrhea?
No.
That's right. If you came into my office, or anybody in this office came into my office, and they had a dog with really projectile diarrhea, and you had to come down here and go to work, and take your dog home and then come down to work, I'd say, I want you to leave your dog here for the day, and we'll start him on medication. And by the time you show up at 4 o'clock this afternoon or 5 o'clock this afternoon, this dog probably won't have diarrhea again. So that's the way we treated him. And that almost always worked. But now we've gotten this thing of, well, if we change the foods and put them on probiotics, that'll really help. And they have different probiotics for behavioral things, probiotics for GI things, probiotics for, behavioral. I mean, it's just there's all sorts of stuff they have these things for. And it's another layer of medications. And the truth of the matter is, this dog got this from drinking out of the bird bath. Now, if we can put them on probiotics and try to repopulate the bowel and get it to where it's in a healthier state, probiotics may help. But most people are looking for a solution today, not 3 days from now or 4 days from now.
It also says that there's a gut-brain axis that refers to the two-way communication between the gastrointestinal tract and the brain.
Yeah, that's right. So listen, if you go out and have a snoot full of let's say cherry flavored vodka or something like that, you don't drink, but I'm just using this. If you drink all this cherry flavored vodka and make yourself stupid, you'll vomit. You'll vomit. Okay. Your brain's what caused you to vomit, not your stomach. Mm-hmm. I know that's what everybody thinks. This is all, the source of this is what happened in the stomach, but the brain's the one that tells you you're going to vomit. Yeah. And so I don't know if you've ever watched us do this, but every once in a while dogs eat chocolate, and we'll give them syrup epicac or apomorphine or something.
Make them throw up?
Make them throw up. Happens at the brain.
Well, technically, we went over this. It's not the chocolate. It's the dark chocolate.
It's the dark chocolate. Yeah.
See, I listen.
Yeah.
It also says that...
cocoa powder and all that sort of stuff.
It says that studies show that the microbiome health can influence anxiety, aggression, and cognitive decline.
Probably. Maybe. I'm not sure that's been proved.
It says studies.
Studies. Peer-reviewed studies? Published studies?
I can ask it.
Yeah, studies. There's peer-reviewed studies, and then there's studies.
It says Dr. Karen Baker and Dr. Holly Gantz
Does it say it was a peer-reviewed article?
Advocates for the microbiome diagnostics.
Well, I just got done going to the ACVI meeting, and they talked about that. And you know what? And there was kind of turned me off. There was a woman, on the stage talking about doing fecal transplantation, because that's how if you have diarrhea, you can't control, and it reoccurs, and you've been on antibiotics. Sometimes we do these fecal transplantations, which means you take dog stool from a healthy dog, and then you mix it in saline or water, and then you run it through a gauze or maybe a sponge or something like that. And then you take that and put it in a syringe and take a feeding tube and run it up the dog's rectum and put
like an enema.
Like an enema, that's right, and put it in there. And that's supposed to correct that. And frequently it does. I got no problem with that at all.
Have you done any?
Oh, yeah, sure. Yep.
How often?
Oh, 3 or 4 times a year maybe.
Okay.
4 or 5 times a year.
Okay. So it's just with dogs with very reoccurring.
Well, I'll tell you who they're really recommended for. If you're running a clinic, and you have a parvo dog come in, and those dogs they're a mess. They have a big viral thing going on. They lose all the architecture of their bowel, their small bowel when they have this, and it's a real mess. And once you can control that vomiting and diarrhea a little bit, they suggest you go ahead and do a fecal transplantation. And they had some data. I don't know if it was peer reviewed, but they had some data to prove that it cut down the stay in the hospital by 2 to 3 days if you gave a fecal transplant.
Oh, I think I heard this at which meeting was this? Was this in Florida?
Yeah, probably at Florida. Yeah.
I thought so. Because I had a lot of people that were walking by talking about it when we were in our
booth. Yeah. So is that a good practice? Yeah, I think that's a good practice. Although some of these people were kind of going overboard with what they were charging for it. There's not much to it. You just go find some healthy dog stool, and you got to make sure they don't have parasites and stuff in it. And that you should probably check.
But so you just ask some other dog that's there? You just go in the room and you're like, hey, does your dog have healthy poops?
Well,
can we take some of it?
It may even be a client or a clinic dog or something like that, and use a clinic dog stool.
Okay. I was curious is where you get the
stool. Yeah, you don't need very much of it, and then you just put it up there. And lots of times that's...
Does it have to be fresh stool?
Yes, it should be fresh stool. Yep, and it will fix it on about the first or second try.
That's crazy.
And it's really... Yeah, I mean, it's kind of weird, when you do it the first time, but hey, the dog gets better. So, we always say you don't know what you don't know. But they've gotten, in my estimation, they've gone a little bit too far with this. Well, your dog's just going to have diarrhea for 3 or 4 days till we get it all cleared up. My thing is, clients came in there, their dog has diarrhea. They're going to have to call a carpet cleaner as it is. Why don't we go ahead and see if we can't take this dog and then you get these hemorrhagic diarrheas. Now those dogs are sick, and some of those dogs will die, and so you have to be you're really walking
what is it again?
A thin line. Hemorrhagic diarrhea. So they have diarrhea so bad,
like blood in the stool.
With blood in the stool, that's right. They're bleeding out of their colon.
Now, when you said it, what the name of it? Hemorrhagic
diarrhea.
Okay, I was wondering if it had
so
to
that's
do with
blood and stool, just blood and stool. I mean, and those things, those dogs are sick, and they usually have to have IVs and antibiotics IV and
like they're
like they're hemorrhaging. They're having a real meltdown in that bowel. So you have a chance to save that dog with the right kind of therapy. And so are you going to let...
Can food cause this?
Probably not.
Blood in the stool? No.
Well, maybe. Sometimes when you get colitis, inflammation of the colon, you get a lot of mucus. Every once in a while you see a dog actually have a stool. It's kind of soft, but there's a lot of mucus in it with flux of blood in the mucus. Mm. So have you ever, not to bring, this is kind of, this will turn your stomach, but every once in a while you get a cold and you blow your nose, it's all clear, and then you blow your nose and it's yellow. Then it's kind of dark yellow and maybe even green with flecks of blood in in your nasal discharge. Same thing. You have goblet cells in your nose, and you have goblet cells in your colon. They produce mucus. That's what
So
goblet
the
cells.
same stuff up here is the same.
Yeah.
Ew.
It's the same cell, same kind of cell.
Ew.
Yeah. We never transplant the cells, just
Okay.
the feces. But that's the way they treat some of these chronic diarrheas. And we don't ever do it on first blush. A dog comes in with diarrhea. Let's do a fecal transplant. And when this has been going on for a few days and you're not getting any place, or you've got a really sick animal like a parvo dog, or maybe even a pancreatitis dog, something like that.
So say I was a client and I was going to my vet, and I would say once a month came in, dog has diarrhea, dog has diarrhea, dog has diarrhea. Is this something that I would?
That could be food. That one could be food, or could be a pathogen.
I was going to say, is this something that the client would want to recommend? Like, hey, veterinarian of mine, can we try this?
Yeah, I mean, if you knew about it, you could. But nobody ever comes in and asks, "Hey, did you ever think about sticking some other dog's stool at my dog's rectum?" Yeah,
I'm
actually,
just giving people information so that they know.
So I actually did think about that, to be honest with you. But I have a good friend of mine that I had to do that twice on before his dog went to be normal. And that dog was a puppy and didn't have anything wrong till it got to be 6 or 7 months of age, and then it got diarrhea.
Dang.
And then we tried changing diets, and we did all the normal things that we would do with a dog that had diarrhea. And that dog got better. We had to be off antibiotics when we did the fecal transplantation. So we'd have to, if he had diarrhea, really bad diarrhea, we'd give him antibiotic, and then hopefully it didn't come back in 2 or 3 days, and then you give him the transplantation.
Right.
But people were getting a lot of money for it, really getting kind of stupid money for it. And I'll be honest with you, it's not that hard to do. And yes, you should make sure this dog doesn't. But they were like parvo testing dogs and doing all sorts of GI panels before they put the stool in there. I think
gotcha.
it's overkill. They do it in people. Did you know that?
No.
They do fecal transplants in people.
Actually,
So that's
I did
where
know that.
that's where the veterinary community learned about it, because they do it in people.
That's crazy.
And lots of times if they're going to do it in people, they'll take a family member and do it, as opposed to somebody strange.
I did know this because I saw something on Facebook posted the other day about like someone donating their poop for this.
Yeah.
And it was like our story. I'm like, ew, who's donating their poop?
Yeah.
And then they were saying, I donated my poop for science.
Sperm, eggs,
donor, egg donor, poop donor.
Everybody wants to be a donor.
That's right.
Donor. But anyway, yes. I'm not sure. I mean, I think this whole story we talked about today is yet to be determined. But it's. And I was just talking to another veterinarian today before we got on this podcast, and I said, there's always this big swing where that's all they can talk about is doing this and not doing that. And it goes on for a few months or maybe even a year or two, and then they move on to something else. And lots of times we end up having to go back to the way we did it before. So far, we've continued to give antibiotics. If this is a first-time dog, has diarrhea, has a history of eating crap in the yard, we put them on antibiotics. I'm not going to put them on a $100 bag of food and $50 worth of probiotics, when I could do it for $3 worth
What about
of medication.
prebiotics? You don't recommend those either?
yeah,
Like once they get healthy.
Once they get healthy, maybe.
I take prebiotics.
Yeah,
They're good for you.
maybe. Do you know they're good for you?
I don't know. I just feel it's the placebo effect. It feels good.
Yeah, well.
I take it and I'm like, I'm healthy.
Yeah. And that's not the world I live in. The world I live in is the real world. But we see a number of dogs with diarrhea, and we treat them accordingly, and we try to do the diagnostics we got to do. And I'll tell you one thing, and before we leave on this thing, we have really good antigen panels that we can run on dogs to see what might be causing diarrhea. Antec and IDEX, the two diagnostic companies, we send them in, we send a fecal in, they get it back, and there's an antigen. So lots of times if I was looking for whipworms, sometimes whipworms are hard to find, and then you won't see them, then maybe you see 2 or 3 eggs. But if you run the fecal antigen, that DNA is always in that stool. So if that whipworm's in there, we know he's in there, or he or she. And if it's a he and she, they're making little heartworms too. So, or not heartworms, but whipworms. And whipworms are really kind of, a lot of them pass, sometimes they don't. And you can get some really very profound diarrheas that are caused by whipworms, and then run a fecal and not find any whipworms. But
That's wild.
We've got a card we play on that son of a bitch now, and that's called the antigen test. So we can tell, whether it's tritrichomonas, all sorts of stuff. So they have all these things in there, and Giardia, those sorts of things. Yeah, there's all sorts of things that cause diarrhea. You try to figure out what you have and treat that.
Mark your cards.
Yeah, you mark the card. So if you have people, like when your little dog came in, we'd run a stool, and if there was Giardia, then we treat him for and I think where you got your little dog, maybe there were other little dogs there, and maybe a lot of other bigger dogs too. And so
which one?
The Jader.
No, there was only dachshunds there.
I know, but there were a lot of them.
There was just the 2 adults and then the puppies.
Okay.
The other puppies.
Okay.
I'm sorry, the guy had a third dachshund. But
okay. Well, sometimes if you have people that have
really that many dogs.
5 or 6 different dogs, or maybe they have a breeding community of dogs, you see a lot of Giardia there, a lot of Giardia, and then you treat that and get rid of it, and it can be hard to get rid of. So actually look for what you should treat, and all this probiotic stuff, that's actually malpractice to take a Giardia dog and give him a probiotic and not diagnose the Giardia. Oh,
this guy actually said, the guy that I got Jade from, he said, I normally, when I have puppies, they all get Giardia because there's Giardia in the water here.
Could be.
So I double treated them before they went home for Giardia and coccidia.
Okay.
I don't know if that's frowned upon or...
No, you can do that.
I thought he was marking his cards. I was
No.
Dude.
No, we had that happen. Somebody came in the other day and they had a dog and they lived in Kalamazoo. He says they had diarrhea off and on, and they didn't have a stool sample. And so I said, well, you could bring a stool sample back. I think what I'm going to do is put you on Panicure and treat you for Giardia. And this will probably all go away. And by the way, if it's hookworms, roundworms, whipworms, or Giardia, I'll get it with my Panicure, my febendazole. And that's all I need to, so that's how we handled that one.
Good.
Yep.
Well, I learned a lot about dogs.
Arkansas and California. Yeah. Too many Democrats, not enough Republicans. Too many Republicans, not enough Democrats.
I was going to say I learned a lot about dog shit today, but that works too.
Yeah, I guess.
All right, let's wrap it up with some outro music. We sure appreciate you guys listening along with us today. We hope that we've been able to share some information that will help you love your animals as much as they love you.
And I'm guessing nobody's going to go out and order a pizza after this.
Nope. Don't forget, always treat the treatable and prevent the preventable. And we will catch you on the next one. And I promise you, before the next one, if it is a sensitive topic like dog poop, we will give you a forewarning so you're not eating.
Okay.
Catch you on the next one, guys.
That's our story.